Most older adults don't realize this, but something as simple and natural as touching yourself could quietly be protecting your heart, your brain, and even your immune system. Yes, we're talking about masturbation, but not in the way you might expect. In this video, we're going to explore how this often taboo topic is actually being re-examined by modern medicine, and why it may hold the key to better sleep, stronger circulation, and even reduced cancer risk in later life. We'll also talk about when it can become harmful, and how to avoid those dangers. Stick around until the end, because I'll share a little-known, research-backed technique that naturally boosts nitric oxide levels and helps men improve blood flow without pills. I'm Dr. Eli Morgan. After 35 years practicing internal medicine, I've learned that health after 60 depends just as much on what you stop ignoring as it does on what you start doing. Let's get something clear right up front. This video is about health, not sex. There's no agenda here, no attempt to shock, and absolutely no disrespect toward anyone's personal, cultural, or spiritual values. In fact, many people were raised to believe this topic should never be spoken about. I get that. But what we now know from hundreds of peer-reviewed studies across fields like geriatric medicine, urology, and neurobiology is that certain forms of solo intimacy, when practiced mindfully, may offer tangible health advantages for older adults. Whether you choose to engage in this practice or not is entirely your decision. My goal is to share facts, not opinions, so you can make informed choices that support your health, vitality, and independence. Masturbation is more than a private act. It can be a surprisingly effective tool for maintaining physical and emotional health as we age, from improving blood circulation and reducing prostate risk to enhancing sleep and mood through hormone release. The benefits are broader than most people realize. In this video, I'll walk you through the most recent clinical findings, explain why they matter specifically for adults over 60, and show you how to avoid common pitfalls that could actually do more harm than good. The 8 benefits, starting with 1, improved blood circulation. Let's begin with something most people don't associate with masturbation: vascular health. As we get older, circulation naturally slows. Arteries stiffen, microvessels shrink, and blood struggles to reach the extremities, especially in men, where blood flow to the pelvic region is crucial for both function and repair. But here's what's rarely discussed: engaging in regular, non-stressful sexual stimulation, including solo, can help maintain healthy blood vessel function. A 2022 study from the University of Florence found that men over 65 who engaged in consistent sexual activity, even without a partner, had significantly higher penile oxygenation levels and less vascular calcification than those who didn't. The same applies to women. Gentle stimulation improves blood flow to vaginal tissues, supporting elasticity and reducing atrophy risk. This isn't about libido. It's about life-supporting circulation. Just like walking strengthens the heart, healthy sexual function keeps your blood vessels active where it matters most. 2. Feel-good hormones and mental health. One of the most powerful and overlooked benefits of masturbation after 60 is its impact on mental health. When you climax, your brain releases a surge of neurochemicals, including dopamine, serotonin, oxytocin, and endorphins. These aren't just pleasure hormones, they're natural regulators of anxiety, low mood, and chronic stress. In fact, a 2020 report from the American Institute of Aging Neuroscience found that older adults who engaged in regular intentional sexual activity had 35% lower rates of reported depressive symptoms and slept better compared to peers who abstained entirely. Unlike medications, this chemical release happens quickly and without side effects, and the mood boost can last for hours. Think of it as a gentle reset button for your brain, helping combat the emotional dullness that often comes with retirement, loneliness, or chronic illness. No partner needed, just a private, natural way to lift your spirits and regulate your mind. 3. Better sleep. Sleep becomes more elusive with age, and not just because of aches or frequent urination. For many older adults, the brain simply doesn't wind down like it used to. But here's where masturbation plays a surprising role. It triggers a release of prolactin, a hormone closely tied to deep relaxation and sleep initiation. A 2021 study from the University of Exeter's Sleep Research Center found that adults over 60 who climaxed before bed, either with a partner or solo, fell asleep up to 20 minutes faster and experienced fewer night wakings than control groups. Unlike sleeping pills, this natural process doesn't disrupt REM cycles or cause next-day grogginess. It's your body's own sedative. And it comes without a prescription. So if you find yourself tossing and turning more than you used to, this might be a surprisingly simple and safe option to explore. 4. Prostate health. For men over 60, prostate health becomes a major concern, and rightfully so. Prostate enlargement, inflammation, and cancer risks all rise with age. But here's something many urologists don't emphasize enough. Regular ejaculation may actually help flush out harmful compounds from the prostate. A landmark 18-year study published in the journal European Urology tracked over 31,000 men and found that those who ejaculated at least 21 times per month had a 33% lower risk of developing prostate cancer compared to those who ejaculated less than 7 times. Why? Ejaculation helps remove inflammatory byproducts, dead cells, and potential carcinogens from the gland. It's essentially a built-in detox mechanism. Even without a partner, regular stimulation can serve this protective function and may help delay or reduce urinary problems associated with an aging prostate. Simple, natural, and backed by science. 5. Vaginal health. For women past menopause, vaginal health can quietly decline, often without warning. Dryness, discomfort, and even micro tears during intimacy become more common due to reduced estrogen and lower blood flow. But consistent, gentle self-stimulation can help maintain the health and function of vaginal tissue. A 2019 study from the Royal College of Obstetricians and Gynecologists found that women who engaged in regular non-penetrative stimulation experienced less dryness, fewer urinary tract infections, and better lubrication, even without hormone therapy. It works by increasing localized circulation, preserving elasticity, and encouraging natural lubrication responses. This is especially important for women who are single or widowed, because without use, tissues can atrophy faster. No partner required, no prescription creams. Just a few mindful moments a week to preserve your comfort and confidence. Your body still deserves care at every age. 6. Boosting immunity. Your immune system naturally weakens as you age, but what if I told you that solo intimacy might actually give it a boost? According to a 2020 clinical trial conducted at the German Center for Immunotherapy, men and women over 60 who reported regular sexual activity, including masturbation, had higher levels of immunoglobulin A, a frontline antibody that protects against colds, flus, and even some gastrointestinal infections. Why does this happen? Because the act reduces cortisol, the stress hormone that suppresses immune function. At the same time, it elevates oxytocin and white blood cell activity, two powerful allies in the body's defense system. This doesn't mean it's a cure-all, but in combination with a healthy diet and good sleep, it's another tool in your immune toolbox. Especially during cold and flu season, every small edge matters. Maintaining sexual function. Just like muscles weaken when they're not used, your sexual organs also lose function if neglected. Regular, gentle sexual stimulation, even solo, helps maintain erectile ability in men and sensitivity and lubrication in women. It's not about performance, but preservation. A 2021 review in the Journal of Geriatric Sexual Health found that older adults who engaged in sexual activity at least twice a week, solo or with a partner, were significantly more likely to retain healthy sexual function into their late 70s and beyond. For men, it encourages blood flow and keeps erectile tissues responsive. For women, it helps the vaginal walls remain supple and reduces discomfort from thinning tissues. The takeaway? Use it or lose it. Consistency, even in small doses, helps keep this vital part of your body functioning well, whether for intimacy, pleasure, or simply your sense of self. 8. Chronic pain. Relief. Chronic pain is one of the most frustrating parts of aging. And for many, daily discomfort becomes the new normal. But few realize that masturbation can offer real, measurable pain relief. When you climax, your brain releases a surge of endorphins, the body's natural opioids. These chemicals help block pain signals, reduce inflammation, and trigger muscle relaxation. A 2018 study from the University of Michigan's Department of Pain Research showed that older adults who engaged in regular sexual activity reported lower perceived pain levels, particularly in areas like the lower back, knees, and hips, common pain points after 60. While it's not a substitute for physical therapy or anti-inflammatories, it can serve as a natural complement, especially on days when discomfort keeps you up or limits your movement. Sometimes relief comes from the simplest source. Why pornography isn't the same. Now, before we go any further, it's important to separate healthy self-touch from something that often rides alongside it, pornography. While masturbation can offer real health benefits, consuming pornography, especially frequently, may actually undermine those gains. A 2023 meta-analysis published in Frontiers in Psychology found that high-frequency porn use was linked to reduced dopamine sensitivity, making it harder for the brain to feel pleasure naturally. Over time, this can lead to decreased motivation, emotional flatness, and even sexual dysfunction, particularly in older adults whose neurochemistry is already more vulnerable. Additionally, pornography tends to create unrealistic expectations about appearance, performance, and intimacy. For people over 60, this can fuel feelings of inadequacy, shame, or anxiety, which ironically counteract the very emotional and hormonal benefits we've discussed. What's more, habitual porn consumption has been linked to higher rates of memory decline and impulse control issues in seniors. According to data from the European Society for Cognitive Health, the key is mindfulness. Engaging with your body doesn't require external stimulation. In fact, ditching the screen may help you reconnect with your own rhythms, sensations, and emotional clarity. So let's step back for a moment. This conversation wasn't really about sex, it was about self-care. At its core, masturbation, when practiced mindfully and without harmful habits, can be a gentle, effective way to support your health as you age. It helps circulate blood, regulate hormones, calm anxiety, relieve pain, and even guard against serious conditions like prostate cancer and sleep disorders. You don't need anyone else's permission to take care of your own body. You don't need to feel guilt, shame, or embarrassment. What you do need is reliable information and the freedom to make your own choices with confidence. Whether you choose to use this knowledge or not, just remember, your body is still alive, still responsive, and still worthy of your attention. Health doesn't stop at 60, and neither should the conversation. If this video gave you something to think about, I'd love to hear your thoughts. Rate this video from 1 to 10 in the comments and let me know if you'd like more content on topics that are usually left unspoken. And don't forget to subscribe. Your support helps us keep these honest conversations going.